Hi there. The intended learning outcome of this learning activity is for the students to be able to discuss the levels of prevention in healthcare and provide examples of each level. Health services exist along a continuum of care and prevention. This continuum consists of primary, secondary, and tertiary prevention. Prevention in this context refers to the wide range of activities or interventions aimed at reducing risks or threats to health. Primary prevention is the first level and it aims to prevent disease or injury before it ever occurs. This is done by preventing exposures to hazards that cause disease or injury, by altering unhealthy or unsafe behaviors that can lead to disease or injury, and by increasing resistance to disease or injury should exposure occurs. Examples include banning the use of hazardous materials like asbestos. And in this example, we are preventing the exposure to the hazardous material. Another example is mandating safe and healthy practices. For example, the use of seat belts and bike helmets. Providing education about healthy and safe habits like eating well, exercising regularly, or not smoking. That's another example. And the classic example always is vaccinations and immunization that are given to increase humans' resistance to disease. Primary prevention is the most cost effective level of prevention. Rational societies driven by sound motives invest heavily in this level of prevention. The second level of prevention is secondary prevention, and it takes place after the disease has already occurred. Secondary prevention interventions aim to address the short term impact of the disease or injury. This is done by detecting and treating disease or injury as soon as possible to stop or slow its progress. It's done by encouraging personal strategies to prevent a recurrence of the disease and by implementing programs to return people to their original health and function, and ultimately to prevent long term problems. Examples of secondary prevention include regular exams and screening tests to detect disease in its earliest stages. For example, mammograms to detect breast cancer. Uh, Another example is the daily low dose aspirin or diet or exercise programs to prevent further heart attacks or strokes. Uh, Suitably modified work so injured or ill workers can return safely to their jobs. These are examples of secondary prevention. The third level of prevention is the tertiary prevention, and it takes place once a long term, complex health problem has developed. Tertiary prevention aims to soften the impact of an ongoing illness or injury that has lasting effects. Tertiary prevention interventions help patients manage long term, often complex health problems and injuries. Example in chronic diseases like hypertension, diabetes, or permanent impairments. In order to improve as much as possible patients' ability to function, to improve the quality of their life and the life expectancy. Examples of tertiary prevention interventions include uh, cardiac or stroke rehabilitation programs, uh, chronic disease management programs, example for diabetes, arthritis, depression, etc. Support groups that allow members to share strategies for living well, and vocational rehabilitation programs designed to retrain workers for new jobs when they have recovered as much as possible. So these are the three levels uh, of prevention in healthcare: primary, secondary, and tertiary. Thank you.